Good afternoon, Santa Cruz and the rest of the world listening out there. This is Dr. Duncan McCollum coming to you live from KSCO Radio, the beautiful town of Santa Cruz, California. Anyway, that was a Blinded by the Light, right? And I got a great show today. I'm very excited about it because of I'm constantly looking for new ways to help people and heal people. And the light therapy that's been around for quite a while is pretty remarkable, and it just keeps getting better. So I'm going to talk about what I have been looking at, what I recently acquired for my office to help people. And it all started with E equals MC squared, good old Einstein, finding the speed of light. And the show today is about lasers primarily. Laser treatments have some pretty fantastic qualities to them, some amazing results. And they're actually well founded in the literature. If you go to PubMed, which is the government's #1 place that they can publish things that are actually quantitatively true, there are over 9,000 studies, double-blind studies on light therapy, red light therapy, and 21 of the 26 studies have been put into and approved by the scrutiny of this by Urconia, which is the lasers that I have. So 21 of the 24, and then a lot of the other laser companies have piggybacked off of the studies and research that have been done by Urconia. Now, when you do a study, a double-blind study that gets approved by the FDA, it is a very, very expensive thing, millions of dollars to get a study done. So the research has to be founded, and you also have to show a 30% difference between your whatever it is you're doing as well as opposed to a placebo. So in laser, you have a red light shining, and then you have a laser, very specific frequency laser shining. And the red light laser actually showed a 30% plus improvement in several different conditions I'll talk about in a little bit, which is pretty amazing, that light, the speed of light and frequency of the color can actually make a difference. And but not only has the red light been studied the most, the violet light is another. It's the most energetic of the visible spectrum of light, 38 nanometers and or 380 nanometers, but it's very, very close wavelength, so it can travel deeper. It's not the amount of power. People get mistaken by, I have a more powerful laser. Well, powerful lasers can actually heat up the tissue, and you don't want to heat up the tissue. You want to energize the tissue to affect something called the mitochondria. The mitochondria is the power plant of the cell, and I'll be going into all of this a little bit as we go. I'm going to read a couple things here. Now, when you have a A1 study from that has been approved by the FDA, Class A1 is the highest scrutiny possible. All 21 of the studies have been A1. So let's see where I want to start here. I do have a slideshow I'm going to put up for those of the people that are going to watch this online later. I'm going to share my screen, and then it will allow me to prompt me to tell you guys all I need to tell you. So first of all, E equals MC squared. We all remember Mr. Einstein and those funny pictures of him. And so today's show is healing at the speed of light. Laser energy fuels the mitochondria. And so I'm going to be talking about the three different spectrums, red, violet, and green, and where they are in this whole subject. The FDA clearance for pain. So what is laser therapy? Low-level laser therapy, or LLLT, non-heating, has been proven to be successful in treating many medical conditions without side effects. So that's what's important. Now, this is proven means that the FDA has cleared it. And things like chronic non-healing wounds. We know that the violet light is really great at helping clearing the chronic non-healing wounds. That's not really in my scope, but The violet light is antimicrobial and any kind of bugs, virus. Even they use it for toenail fungus now. Chronic joint pain. Now that is definitely in my scope. There's the records on that are, and the studies show absolutely hands down that it is effective in helping that. In fact, these are more effective than the painkillers that people are taking, the NSAIDs, which actually kill the mitochondria along the way when you use it chronically. And actually a lot of the opioids, and I'll be talking about how many people have died in the opioid epidemic, which is being used primarily for pain. And the red light therapy is actually proven to be as helpful, if not better, because it's not killing the body. It's also great for muscle strains and tears. So athletes, people that work in the field, construction, any kind of physical activity, lifting people in the hospitals, chronic muscle strains and tears, we see that all the time. Degenerative conditions. So most people who have had an injury that's been around for a while in their spine are going to have spinal degeneration or osteoarthritis. And even the different types of arthritides are causing degeneration. And this is a lack of energy at the cellular level. The lasers will actually turn on the mitochondria, giving the joint more energy, the cell more energy to heal. The body can't heal when it has no energy. This is why animals go lay down under a car when they're sick and shut down everything else so the body can heal. Even on Star Trek, they shut down all life support except for the shields, so the Klingons couldn't get them. So they shut down the non-necessary life conditions. They slow them down so they can put the energy where it's most needed. Post-surgical pain, these lasers have been cleared by the FDA to help with post-surgical pain and healing. Tendon and ligament injuries, very common with people who play sports. Achilles tendon, it's actually FDA cleared for plantar fasciitis. And bone fractures. Chronic neck and shoulder pain, FDA cleared. Carpal tunnel syndrome, FDA cleared. What's this mean? It means that you can have treatment that is showing a positive result in a high number because the FDA wouldn't clear it if it didn't. So these are the studies that are out there. Low-level laser therapy has been used worldwide for over 50 years to relieve pain, remove scars, heal wounds, regenerate nerves, and solve addictions. So they started using it a lot in Russia back in the day. Human cells produce a chemical known as ATP to run the body and to heal tissue. ATP is like, remember STP was the racer's edge? Well, ATP is the body's energy edge. And we need ATP, and the lasers, as I will go into in a little bit, turn on the body's ability to make more ATP, which goes into this, it becomes a fuel for the carburetor. So if you can imagine, crude oil has to go through several steps to become gas. You try to burn crude oil in your gas tank and you won't get anywhere. It has to be converted to gas before it will work. Well, when you get energy into the cell, which is in the form of glucose or ketones, the only two energies that we can burn, then ketones or glucose has to get into the mitochondria cell wall to the power plant, and it has to be converted to ATP. It can't just have glucose get into the produce energy. It will make it's toxic and it would kill you. So lasers have proven to turn on all four processes to get ATP, to energize the cell, to get the body tissue to heal. All our body's activities result from ATP. It's like gasoline in the car. Laser therapy stimulates the microstructure within the cells called mitochondria to produce higher amounts of ATP, thus more ATP at the cellular level. Tissues heal faster, and therefore relief comes quicker. So when your body has the energy to heal, it does, right? Unless you have some other issues wrong, some other toxicity levels, or there's other situations. But actually at a cellular level, there's nothing greater than this that isn't going to kill the cell the same time it's trying to get you out of pain. So photon energy is absorbed by the mitochondria. And just like the sun hits a leaf and causes photogenesis, creating chlorophyll, the sun hits a leaf, causing this photogenesis that causes the leaf to create chlorophyll that feeds the plant, feeds the tree, and keeps it alive. Think of these huge, giant redwood trees. How do they stay alive? From the sunlight hitting the leaf, creating energy at the cellular level of the leaf. And the difference between chlorophyll and blood is one specific substance, where in blood you have iron or heme. Chlorophyll only differs by one element. And that's pretty interesting. So when we have the light hitting our skin, just like sunlight would create chlorophyll in the leaves of the tree, photosynthesis, as the sun hits the leaf and creates photosynthesis and turns into chlorophyll, sun hits our arm or our face and creates vitamin D. That's a biochemical response, a biochemical change from the sunlight alone. So light alone, right? So we now know that the spectrum of visible light from violet all the way to red is healing, because as that hits the light, just as the sun does, it creates a biochemical reaction in the body. And that biochemical reaction is actually producing energy at the cellular level. So just think about this way. How do low level lasers work? That's hard to say. How do low level lasers work? Number one, they increase cellular regeneration. Absolutely proven. Cellular regeneration. This involves the physiology of the cell membrane, the mitochondria, and the synthesis of ATP. So the cell membrane is very important here, because I've talked about it on many shows where the toxins in our body affect the cellular membrane. So of course, we want to make sure that the body isn't completely toxic, but even if it is, we can help start your healing process with a low-level laser. Low-level laser also increases cellular communication. This involves a nervous system, phospholipids in the cell membrane, proper oils in the cell membrane, and the meridian system of the body all integrate in order to get the body to heal correctly. So it's pretty amazing. And don't get too stuck in all of this science I'm going through. It's pretty fascinating. But the most energetic laser in the world, the ones that we have, the Zirconia lasers, are the most energetic lasers in the world. They've had the most approved studies by the FDA. Out of the 26, they have 21 that they put through and had approved for efficacy. And the violet range starts at about 400 nanometers and goes up to 760 nanometers in the red. So we're dealing with the violet and the red. It all started with red, and then they found out that violet was much more energetic and much more healing. Well, guess what? Now they're using green lasers since 2022. They were not able to use green lasers and get them approved by the FDA. This is pretty amazing that they have all been approved by the FDA. So the electromagnetic spectrum and the physiology affects the various microorganisms. So we know that viruses, bacteria, fungi, and parasites are all affected by the visible light spectrum. So for instance, when people have acne on their face and stuff, the violet laser can be used to actually break down the microorganisms that are causing the problems in there. It's pretty cool to see the diagram of the mitochondria electron transfer chain. So there's this kind of a crazy thing. It's called the mitochondria electron transfer chain. Now, we all studied science one time and we all looked at a cell. Remember, there was a nucleus in the cell, and then there was a ring around the nucleus called a valence, and then there were bigger outer and outer valences. Well, the farther out an electron is, the more energy it has. And it will want to bounce back because it's always looking for the least amount of effort. But when you hit a cell, which we have 75 trillion cells in our body, all of them have mitochondria except for one type of cell. The only cell in our body that doesn't have mitochondria in it is a mature red blood cell. Every other cell in our body can be affected and helped by these lasers. So the violet laser, it's like I mentioned, when you get crude oil, you got to turn it into gasoline. When you get fuel into the cell in the form of glucose or ketones, it has to be turned into ATP so that it can actually be used and burned. So there's 4 doors. There's 4 steps to electron transfer chain. Violet turns on door 1 and 2. They were only using red laser, which was the last door to open before you got ATP, and it was successful. But now they've found out that door 1 and door 2 are turned on by the violet laser, and then the green laser turns on door 3. So you were only getting in through door 4. Now we've opened the floodgates with door 1, 2, 3, and 4 to turn your body into ATP for the healing. And you may or may not remember the Krebs cycle, but part of this takes place at the Krebs cycle level. So right now there are 365 million people that live in America, 365. 12 million of them have cancer, 26 million have diabetes, 17 million have heart disease, 7 million have had a stroke, 25 million are diagnosed with thyroid disorders, 25 are diagnosed with peripheral neuropathy, and 25 million are diagnosed with at least one autoimmune disease. That's pretty remarkable. Now, the cool thing, and I want to apologize for what I'm going to say, because I've been so focused on cellular energy and detoxification, peripheral neuropathy, and all these things that I forgot the biggest group of people in America are people with chronic pain. All of those numbers that I just give you don't add up to how many people live in chronic pain in the United States. So we can do whatever we can to increase our energy, our digestive systems, the 14 different systems in our body, but neglecting the fact that chronic pain is the #1 reason people take drugs in this country is pretty crazy. So I want to apologize for that, but now know I'm doing this show today for those of you in chronic pain, because not only do we have the ability to use Einstein's theory of sound or light, E equals MC squared, but as you all know, we also use sound in our office. The TRT machine, the tissue regenerative therapy machine, runs on sound. That sound comes at 3,358 miles an hour out of the head of that TRT machine, of those of you who have tried it. And that goes in and it will break up scar tissue wherever we focus the beam of the soft wave machine. Will break up scar tissue. It will recruit whatever stem cells you have into that area. It will break up scar tissue and actually move fluid out of there. So the stagnant lymphatic fluids. So here was what's so cool is not only can we now create or generate the movement of your own stem cells to an injured area, but now that's sound. Now, if we hit it with light through the lasers, we can actually energize those cells, energize the mitochondria in that area to create even a greater effect. So the people that are using lasers out there are doing an amazing thing. The people with the soft wave therapy out there are doing an amazing thing. I am so excited that I'm being able to offer both to our community. Now, not only the #1 lasers in the world, the highest rated lasers in the world, the highest energy lasers in the world, and all 3 spectrum of the light, all 3 of them, but also that I have sound. So we're healing with sound and light in our office. That sounds like the wave of the future, and I'm very excited about it. I'm going to read, let me see what I had next here. Yeah, 100 million Americans have chronic pain. You cannot correct structural pain with drugs. That's a big misnomer. You cannot correct structural pain with drugs. So Vioxx and all those other drugs that people were given way back in the day, and Vioxx killed something like 27 million people, a huge number. Maybe it's 27,000. Don't quote me on the number, but it was too many. And they knew that, they knew it. They knew that it was going to, that it did have fatality, and they did it anyway. And they were fined $5 billion for the fact that for the people that died, and they were busted knowing that it did kill people. But they made 35 billion. So 35 billion minus 5 billion of a known risk still made them $30 billion. So that's who we're dealing with. And this is why I was supporting Robert Kennedy, because he wants to get rid of this thing, man. He wants to get rid of this industrial drug complex that has basically got us rated 78th or 79th in the world for health. And, you know, they're treating their pain with things that are killing their mitochondria. Exactly the wrong thing to do. The more you take those medications, and don't stop any prescription drugs. I'm not a medical doctor, but you can definitely ask your doctor for help on looking at other things. So in order to pass a study with the FDA, certain things have to be qualified. And the first one, they did red laser only. The first study was done on red laser only. And they had to have, the people couldn't do anything else other than the laser treatment. They had to be in pain for a duration of 61 months, so 5 years of pain. And the people that had success was 65%. 30% had to have 65%, 30% had to have, had to have 30% pain reduction, and they did. The percent of improvement from pain from baseline immediately after the treatment was 48%. Percent improvement in pain from study endpoint to 48 hours post-treatment, 43%. Improvement in range of motion, 14%. Those are all numbers, you know, doesn't matter. But when they did the violet, it jumped up another 10%. And when they did the green violet, we're talking about almost 90% reduction, 80% reduction in pain, 52% improvement. That's just phenomenal, the studies that they put out. But the proof is in the pudding. And, you know, there are a lot of limiting factors. That's one reason I always do consultations at no charge to find out whether or not what I do at my office may or may not help somebody. And we know we don't accept all patients, because if sometimes I don't think it can help them, I'm not going to accept them. I don't want to take your money if I can't help you. So the green laser, the photon energy is absorbed by the mitochondria. And then again, mitochondria is responsible for 90% of the ATP our body needs to function, and has a pivotal role in cell life and cell death. Mitochondria dysfunction is common in long COVID, fatigue, aging, neurodegenerative diseases, and autoimmunity. And we know that, you know, 25 million Americans have peripheral neuropathy, 25 million Americans have autoimmunity. Long COVID is, you know, really affecting people, and there are people aging out there. There's 10 biological effects from laser that we can talk about, because the FDA has agreed that they are true. The number one is anti-inflammation. Low-level laser therapy creates an anti-edema effect by dilating the blood vessels and activating the lymphatic drainage system, which drains swollen areas. This reduces swelling caused by trauma or inflammation. Anti-pain, analgesic. Low-level laser therapy exerts a very beneficial effect on the pain in multiple ways. It particularly blocks neural transmission of pain. It blocks neurotransmission of pain signals to the brain. It decreases severe nerve sensitivity. Laser light also lessens pain by reducing edema. The swelling is going to push on the nerves. A fourth pain blocking mechanism involves the production of high level of pain-killing chemicals such as endorphins, enkephalins, and opioids from your brain and the adrenal gland. So our body creates these in themselves. We have endogenous opioids in our body. Opioid epidemic is terrible. I have some numbers here. Accelerated tissue repair and cell growth. So photons from light, just like the light on the sun creating vitamin D, penetrates deep into the tissue and accelerates cellular reproduction and growth. The laser light also increases the energy available to the cell by increasing ATP production so that the cell can take on nutrients faster and get rid of the waste products. That's what it is important. You got to clean out the toxins and be able to take in the nutrients. It's like having a dirty sponge that's sitting there with the same water and dirt in it. You got to be able to wring it out. And this is one thing that this light therapy is showing to do. As a result of exposure to laser light, all cells, including the cells of tendons, ligaments, and muscles, are repaired faster. This is approved by the FDA. It's cleared. Improved vascular activity. Low-level laser therapy significantly increases the formation of new capillaries and damaged tissue, which speeds up the healing process. So it increases more capillaries, closes wounds and more quickly, and reduces scarring. Scarring is one of the big problems with injuries. It stops the function in the area, decreases range of motion and all that kind of stuff. Okay, low level laser therapy also causes vasodilation, an increase in the diameter of the blood vessels, which improves the delivery of blood and healing elements to damaged tissue. It increases metabolic activity. Low level laser therapy stimulates higher outputs of a specific pro-healing enzymes in the blood, along with improved oxygen and nutrient delivery. Trigger point and acupuncture points. Low-level laser therapy stimulates muscle trigger points and acupuncture points on the non-invasive basis, providing musculoskeletal pain relief. Reduces fibrosis, tissue formation, and reduces scar tissue. Reduces the formation of scar tissue following tissue damage from cuts, scratches, burns, or surgery. Improves nerve function. Well, that's a chiropractic's bread and butter. Slow recovery of nerve and damaged tissue, and the result in impaired sensory of the motor function. Low-level laser therapy speeds up the process of axonal regeneration and nerve cell regeneration, and increases the amplitude of action potential to the optimum muscle action. So what they're saying is this increases the growth of the peripheral nerves. We know the peripheral nerves can grow a millimeter a day if you do the right things long enough. Immunoregulation. Low-level light therapy directly affects immunity status by stimulating the production of immunoglobulins in the lymphocytes, and by improving the ease of penetration of white blood cells, improving the ease of penetration of white blood cells to damaged tissue. White blood cells are your immune system. Faster wound healing. Low-level therapy stimulates fibroblast development. Fibroblasts are like the plugs, which is predominant in wound healing in damaged tissue. Collagen is the essential protein required to replace old tissue or repair tissue injuries. As a result, low-level laser therapy is effective on open wound healing, which again is not in my scope, but it's good to know. Let's see. I think that's the last of my slides here, but I am going to read a couple more things out of the book here. And I have a book that goes into all of the stuff that these do. And let's see, page 27. Okay, good. The Zirconia FX 405 and 635 received clearance from the FDA for nociceptal musculoskeletal pain back in 2019. So back in 2019, the FDA cleared this laser for treatment of muscle pain, nociceptive muscular pain. That means pain. Okay, previous Zirconia clearances from the FDA have already set Zirconia doctors apart from the rest of the therapeutic industry. All previous pain-related FDA clearances have been limited to specific areas of the body. Now, this is cool. Now, Zirconia has the only whole body indication base on level 1 clinical data, the most scrutinized of all. Based on this, the results, the fact that there are no known negative side effects and that it's non-addictive and it's not addictive, Zirconia low laser technology should be considered first. It's more effective than opiates or NSAIDs when treating chronic musculoskeletal pain. When you compare the SPACE study results with the results of Zirconia that have been submitted to the FDA. Pretty cool, huh? All right, so if it's a little technical, I apologize, but I don't know how else to get this out to you. Now, there are different stages of pain. In the chronic pain, stage 4, this is pretty interesting. Chronic pain, okay. So chronic pain is medically described as pain that has been lasted 3 to 6 months or longer. Examples of chronic pain are chronic back pain without a clear determinant cause, failed back surgery syndrome, we see a lot of that, continued pain after surgery has completely healed, fibromyalgia, and much more. This constant or intermittent pain has often outlined its purpose as it does not help the body to prevent injuries. So there's 3 different types of chronic pain classified. Chronic pain can be significantly reduced by proper initial treatment, and the laser provides many physiological advantages over other commonly used modalities. There are at least 3 different types of chronic pain. Chronic pain due to an identifiable pain generators, like an injury, pinched nerve in the back, cut, things like that. The second one is chronic pain with no identifiable pain generators. So many times people come in and they're in chronic pain and nobody can tell them where the pain's coming from. They do MRIs and they go, I think it's here, I think it's there. Let's put a cortisone shot in there and see if it helps. It's a shot in the dark to find out where it is. And then there's neuropathic pain. So chronic pain, I'm going to go through the 3 of them. Chronic pain due to an identifiable pain generator. The type of chronic pain is due to a clearly identifiable cause due to a diagnosable abnormality problem. So that means that we can see it. We can see the problem. Stenosis, arthritis, slip discs, soft tissue sprains, surgeries, things along that line. These tissues, tissue regeneration is activated, leading to an enhanced recovery, and patients have a more significant opportunity to avoid invasive therapies such as drugs and surgery. The second one is chronic pain with no identifiable pain generators. This type of pain continues beyond the point of tissue healing. In other words, your body's healed, but you're still in chronic pain, and there's no identifiable pain generators to explain the pain. It is often termed chronic benign pain. It appears that pain can set up a pathway in the nervous system. Interesting. It appears that the pain can set up a pathway in the nervous system, and in some cases, this becomes a problem in and of itself. It just sets up a pattern and pathways in the nervous system. In chronic pain, the nervous system may be sending a pain signal even though there is no ongoing tissue damage. It just keeps sending the signal. It's like the war is over, right? You heard about the World War II ended and there were people on an island of both sides of the army and they didn't know the war was ending. They just kept fighting. The nervous system itself misfires and creates pain. The benefits of cellular communication and neural integration provided by the laser are beneficial to regaining proper neurological and cellular communication. So I know this is a lot of technical mumbo jumbo, but it's pretty cool, okay? This third one is neuropathic pain, also called nerve pain or neuropathy. Now, we treat a lot of neuropathy in our office. We were getting amazing results already. And a friend of mine said I should get this laser to help with my neuropathy patients. I go, we're getting great results. He goes, well, you could get better. I went, oh, dang it. I guess I got to go out and buy this darn thing. And I did. and I'm very happy with it. And the studies are phenomenal. The FDA clearances, if you go to PubMed and type in low-level laser therapy, effectiveness on neuropathy, back pain, neck pain, carpal tunnel syndrome, heel pain, you're going to see the PubMed, which is, again, the government governed site, and you can read up on this stuff yourself. Don't take my word for it. Just go do your own research, and then we may or may not be able to help you based on other circumstances. When you come in and we do sit down for a consultation, I'll find out whether or not I think I can help you or not. So no neuropathic pain could be placed in the chronic pain when it has no identifiable generator category, but it has a different feel than chronic pain of the neuromusculoskeletal nature. When you have a pinched nerve in your back, okay, or a pinched nerve in your neck, and therefore is separate in medical literature and diagnosis. Neuropathic pain is often described with the following terms: sharp, severe, lacinating, lightning-like, stabbing, burning, cold, and or ongoing numbness, tingling, or weakness. It may be felt traveling along the nerve path from the spine down to the arms, hands, or feet. Individuals with neuropathic pain do not respond to opioids. They do not respond to opioids such as morphine and NSAIDs and such ibuprofen, COX-2 inhibitors. So they're prescribed these things, or gabapentin, or Celebrex, and these other things, but they're not getting better from it. And you cannot medicate yourself out of a chronic pain. You can't drug yourself out of chronic pain. You can drug yourself, but the chronic pain is not going to go away. These individuals, unfortunately, then qualify for much more invasive therapies, such as nerve blocks, injections, and surgery, many times the side effects of the treatment being as bad or worse than the original condition. The laser has been proven to be safe, effective modality, a safe and effective modality to aid in the recovery of all types of chronic pain. So anyway, it's pretty amazing. I'm going to read a couple more things here. See, laser. There are at least two guys. One was called Grathus in 1817 and Draper in, I think, 1845 or something. And that's called the Grathus-Draper law. Radiation produces a photochemical action only through absorption of its energy by a substance. Okay, so what they're saying is you shine light on a leaf and photosynthesis occurs, creating whatever that stuff, chlorophyll, right? And you shine light on a sun on a skin and it creates vitamin D. You shine lasers of the spectrum of high quality, low power, high intensity lasers on the skin in all three spectrums, which we have, and you're going to create a biophysiological effect in the body on the mitochondria level, turning up the ATP power so the body and the cell can heal themselves. Lasers work by, one, increasing the energy necessary for injured cells to heal and regenerate. So lasers work by increasing the energy in the cells so they can actually heal. Number two, they actually increase intercellular communication. So the real cool thing about the lasers too, we put them on different parts of the body and it stimulates wherever we are putting them. And the FX 405 they spin around covering a very broad range. It's like a circular watering hose that you put on your garden. It goes tick, 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 around in circles. So we get a very broad, diffuse amount of these lasers on the body to create this biochemical reaction, photogenic reaction. But blood is constantly going through this area, and there are free-floating mitochondria in the blood. So as the blood travels through the surface of the skin, being exposed to this laser, those free-floating mitochondria are energized, and then they're floating around in the body, and who knows where they end up. So the effects, our systemic effects from these treatments are phenomenal. So photobiological benefits of the low-level laser are a process, according to research, do increase circulation, ATP and the neurotransmitter. They increase ATP, they increase neurotransmitters, they increase nitric oxide. They also increase something called interleukin cytokines, which decrease inflammation and decrease pain. They actually go to every cell in the body that contain mitochondria. So lasers work on every cell in the body that contain mitochondria. The only cells in the body that don't contain mitochondria are the mature red blood cells. So it is incredible to think that in a world controlled by the pharmacology, that a safe, effective, non-pharmacological device would be FDA cleared. I'm going to say that again. It's incredible to think that in a world controlled by pharmacology, that a safe, effective, non-pharmacological device would be FDA cleared for the #1 neuromusculoskeletal problem in the world, and that is pain. However, it is reality. So this is, a turning point for us to be able to get off of medications and actually learn how to live healthily. Okay, the natural healthcare clinicians are using a historic and epic cutting-edge device to achieve decreased inflammation, which increases circulation, enhancing energy by enhancing ATP synthesis, and all of the living cells are being treated and enhance the healing. Acute conditions of the neck and shoulders. This is second to none. Most common problems are experienced in the world are the Zirconia laser is being approved by the FDA or cleared by the FDA for the use of this. So anyway, that's a lot of information. You can tell I'm excited about it. I've been up almost every morning at between 3 and 4 o'clock to get on line and start studying more and more and more. And I have to study this stuff. All of the teachers, I go to 1.5 speed. I wish they went to 2, but I'm studying like 2 to 3 hours a day, which means 5 hours in the morning if I were to go slow time, so I can really understand how this stuff works. But again, I'm excited about the laser, but what I'm more excited about is a laser coupled with not only the stem cell TRT program, the soft wave therapy, which is the sound. So we have sound coming out at 3,358 miles an hour, which will bring your stem cells to the area, help break apart the scar tissue, push out the toxic chemicals that are keeping the tissue damaged, again, bringing in your own stem cells and bring in the nutrients necessary for the area to heal. Now we hit it with a laser to take those stem cells and supercharge the mitochondria in the area to facilitate healing even more, not only with the new stem cells, but with the tissue that's still there in general. Then we take a look at your toxic level. We have something called an oleoscan, which is a photocytometry. It looks at the cells. It can break down exactly what's in the cell in about a minute that we do this photocytometry on the hand. And this will actually tell us your nutrition level, your mineral level, your enzyme level, and your heavy metal levels, which are really important. So many people have peripheral neuropathy or numbness, and I ask them, do you have brain fog? And they say, yes. I go, well, your mercury is high, because mercury causes brain fog. And we've all been exposed to it in our own life, 4 generations down through mom's umbilical blood, as well with all of the new forever chemicals in the environment, the glyphosates, the stuff that's in our food. If you listen to Bobby Kennedy talk about our dead food, and that the Food and Drug Administration is in treason because they actually allowed us to, the food and drug industry, to put toxic chemicals into our foods to make them addictive to us. So we've got a long way to go to turn all this around, but you put one foot in front of the other and you just keep walking. So I really appreciate you guys all being out there today. And I hope this was helpful. if not enlightening, no pun intended. We're healing at the speed of light in my office, and we're using sound and light. Chiropractic is absolutely the most amazing thing in the world as far as healing and freeing up the nervous system and the body's innate ability to heal itself. And that's what chiropractic does. It heals from above down, inside out, not from outside in with medications and things that now we know kill the mitochondria while it's dulling your pain. And it's not curing anything. Just take a look at the fact that we take 70% of all the drugs in the world, and we're still rated now. I heard Bobby Kennedy say something about 79th in the world for health, and we're only 4% of the population of the world. So we got a lot of work to do. And we want to make sure that you all get a chance to be healthy. Nothing in this whole body issue is going to happen in a heartbeat. There are no magic pills. Some of these conditions have taken a lifetime to get you there. It's going to take some work, some money, and some time and dedication and work on your part. I'm not going to give you a fish. I want to teach you how to fish, but I am going to help you understand whether or not we can help you or not. And if we can, I'm looking for people that are seriously want to get well. I'm not looking for people necessarily that want everything done for them, because you have to be involved in your healthcare. It's just not going to happen any other way. And so if you're interested, we're doing amazing things for peripheral neuropathy. And we have those workshops periodically. Peripheral neuropathy is when the nerves at your toes and your hands and your feet and even the organs in your body stop functioning well because the nerves are dying. That we're talking about regenerating the nerves. The reason the nerves are dying, they're losing their energy. They're losing the strength of the individual cells that are covering up the nerves, and the nerves have their own mitochondria. And as those mitochondria are dying, the nerve's going to die. The laser is shown to increase the mitochondria energy in your cell. There's a lot of different things that you can do to increase your mitochondria. It's not a topic of this show today, but just know that there's hope. We're very busy at our office. And we always have room for one more patient who's serious about getting well. Literally it does take work, and it does take mine and time, and these machines do cost money in order to run them. So just know that coming in. I wish that the rest of the medical community would do this, use these things, but they don't, and they're part of that pharmacological medical complex that is going to be, you get what you get. And we're here to help people that are serious about changing their health and their life. So today's show has been inspired by none other than Albert Einstein. Albert Einstein, he was a pretty cool dude, and he came up with E equals MC squared. And that's what laser is. Laser is the speed of light. We're healing at the speed of light. It is phenomenal. I'll be doing more shows on this, but you can always find the show on ksco.com. You go to KSCO and you find McCollum Wellness Radio, and you can click on the different shows. They're all there, and you can share this with somebody that you would like to see. Let's see. I think I just got a message from one of my other doctors. Anyway, this is Dr. Duncan McCollum, McCollum Wellness Radio. I'd love for you all to participate in getting well in my office. And we look forward to seeing you soon. I'm getting a little distracted here. I got to stop sharing my screen. And there we go. All right. So to recap, your body has an amazing ability to heal itself. All you have to do is give it a chance. You got to get out of the way. Dr. Reggie Gold, one of the greatest chiropractors who ever lived, says your body needs no help. It just needs no interference. So when you have things blocking your body's ability or your cell's ability to get energy. These are toxins inside the cell that stop the mitochondria from working well. They poison the mitochondria. Medications, especially pain meds, get in the cell, poison the mitochondria, and they turn down the nervous system's receptors of what's going on. So it may give you some relief, but it's killing you. It's aging you quickly. And maybe you're comfortable with that. I'm not personally for myself. And that's why I'm constantly picking out and looking for new ways to help. That's why I've been part of Dr. Pompa for almost 10 years now. This fix the cell to get well. That's his motto. And we need to do that. That again takes time and energy, and it takes a commitment on your side because, 4 generations of heavy metals have come down through mom's umbilical blood. You've accumulated all of your own through just lifestyle. And if you're anybody like me, I made sure that I dumped as many toxins as I could in my body when I was younger. And I've been working ever since to try to reduce them, and got a ways to go, as we all do. It takes years, not months, to get healthy. But you got to pick the things that are the biggest battles first. If you've got peripheral neuropathy, your boat is sinking, the ship is sinking, you got to bail out the boat. We've got to fix the peripheral neuropathy or lessen it, stop it from advancing, then we bail out the boat. Bailing out the boat would be getting rid of the toxic chemicals and stuff. But the other thing is this low-level light therapy, laser therapy, is pretty amazing. We'll be doing more on it. You can always call the office for a consultation, and then we can find out whether or not it makes sense for us to work together. And again, I'm looking for people that know that they need to change, are willing to work for it, and they understand that, it's not just a walk in the park. You can't medicate yourself out of a chronic condition. You have to do some hard work to get there. And there is hope, though, because we've seen amazing miracles in our office with the soft wave therapy machine, with chiropractic, with the detox program, and now with the laser. Even in the few weeks that I've had it, we've been seeing some pretty amazing results. So this is Dr. Duncan McCollum coming to you from KSCO Radio. And we're talking about light. We're going to listen to a song about light. And don't be blinded by the light. Come on in and let's get you fixed. We'll talk to y'all soon. See you next week.